Funding for Surviving Stroke comes from the Dr. Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, the Sisters of Charity Foundation of Cleveland, the Woodruff Foundation, the Community Foundation of Lorain County, and the United Black Fund of Greater Cleveland, Incorporated.
The most important thing with stroke management is time.
When stroke strikes, see what happens inside the human brain.
Well, this is an actual human brain from a deceased patient.
From surgery to clot busting, witness life-saving and life-changing treatment.
After my stroke, I couldn't talk.
He's continuously working on his recovery.
Now follow one family's experience, a story of surviving stroke.
Two years ago, the lives of Bill Forrester, his wife Lori, and children changed dramatically. The ordeal began with the family watching TV on a hot summer evening. Bill Forrester was not feeling well and went upstairs.
He decided to go to bed because he was not feeling well, his head hurt. My daughter Sierra wanted ice cream. I asked Bill if he wanted anything. He said he wanted sherbet.
While Lori ran to the store to get the ice cream, their daughter Sierra stayed behind.
Dad?
Suddenly, she
Dad.
heard her father fall down.
So I went upstairs and I went to open the door and I started freaking out because it wouldn't open. And I was
Dad, are you
like,
okay?
Dad, are you okay? And he couldn't say anything to me.
Dad,
So I knew
make a
something had
sound.
happened. So I didn't know what to do. So I called my brother because I trust him a lot and we're really close. And he doesn't live too far, and I know if anything happens, he'd always come.
I rushed home and I got home within 10 minutes, and I went up to his bedroom door and I had to push through it to push past him where he had fell. I reached down, I looked at him, took his pulse, and we realized that there's a really bad situation going on. So I immediately grabbed my phone and I called 911.
Come home 15 minutes later and my world has changed. There's an ambulance in the driveway and it was 15 minutes and everything's different.
In that 15-minute time frame, Bill Forrester, at age 51, became one of the almost 800,000 Americans each year who suffer a stroke. Most people who survive a stroke suffer debilitating, permanent damage. Bill Forrester is an exception. His story illustrates what's possible when things are working in your favor. In this program, we're going to follow his story. And using an actor to portray a stroke patient, we'll also take you inside the hospital to see how the most common type of stroke is treated. Every 40 seconds, someone, somewhere, suffers a stroke, which is damage to the brain caused by the disruption of blood flow.
So the most common kind of stroke is an ischemic stroke, where the brain is deprived of blood flow, and it's pretty much like a heart attack is. We call it a brain attack.
Ischemic are blockage kind of strokes caused by blood clots. They account for about 85% of all strokes, and most stem from the same thing that causes most heart attacks. In a process known as hardening of the arteries or atherosclerosis, plaque buildup contributes to the formation of a clot that basically acts like a dam, blocking blood carrying needed oxygen.
The area of the brain that is typically supplied by that black blood vessel no longer gets nutrients and it dies.
The second category of stroke, which accounts for about 15% of cases, stems from bleeding. Blood vessels rupture and cut off blood flow to parts of the brain. Or sometimes balloon-like blisters called aneurysms form on the side of vessels and burst. To understand exactly what's happening during a stroke, we're going to examine both live and dead brains.
This is where we'll be making the incision.
These surgeons are shutting off the blood supply to an aneurysm to prevent a stroke. With the removal of this small piece of skull, we get a glimpse of a living brain beating inside the body.
This is a frontal lobe and this is a temporal lobe, and it's beating 2 times. It's beating once with every heartbeat, and it also, you can see it sort of expands up and out when you take a breath. So that's a normal beating of the brain.
Now neuropathologist Mark Cohen shows us what a brain looks like outside the body.
So this is an actual human brain from a deceased patient?
Correct.
And show me the anatomy of the brain.
Well, atop of the brain here, all this is, we call the cerebral hemispheres, and this is what most of us think of as our thinking and acting brain.
The average adult brain weighs about 3 to 4 pounds. Lots of veins and arteries run through it, acting as the irrigation system. Two main blood lines, a carotid artery on each side of the front neck, help feed an intricate set of pipes on each side of the brain. If a pipe on the patient's right side of the brain gets blocked, it can cause left side paralysis, while a blockage in the left brain can affect movement on the right side. Dr. Cohen explains that pipes on the left also feed areas that control speech.
We have areas which control language, which are right up in here and right back here.
So your brain is like a computer. Every part of your brain is designed to do a specific function. When part of your brain doesn't get blood flow, that function is lost. So if it's the part of your brain that controls your motor control, you become paralyzed. If it's the part of your brain devoted to vision, you go blind. If it's the part of your brain that's devoted to language and speech, you can't talk. Hold this left arm up. Can you hold it up? You're in the hospital.
Just like heart attack, stroke is an emergency that requires immediate medical attention.
You need to recognize the symptoms immediately and call 911.
One easy way to remember the most common symptoms of stroke is with the acronym FAST.
F stands for face, somebody has facial droop. A stands for arm, somebody has arm weakness, actually, or leg weakness or numbness. S stands for speech, somebody actually has difficulty speaking, slurred speech, or has difficulty understanding somebody else's speech. And T is time. Time is brain. 32,000 brain cells are lost every second during a stroke.
Bill Forrester had a blockage kind of stroke in a vessel on the left side of his brain. Besides hardening of the arteries, there are other less common causes of blockage strokes. And Forrester had one of them, a tear in the wall of his left carotid artery.
What you see as you come up is you begin to see all of this white area, and this is his stroke.
Forrester's survival and recovery depended on the latest and greatest medical science has to offer.
How you feeling? Can you talk to me? I want you to squeeze my hands.
The name of the game in treating the blockage kind of stroke is to get rid of the clot as quickly as possible.
I'm gonna move you to the cart here. So I'm gonna put this on your finger.
A blood clot can plug a blood vessel just the way your drain becomes stopped up with hair or sludge. We have compounds now, drugs, that can dissolve that blood clot the way Drano dissolves the blockage in your pipe.
The Drano drug of choice is called TPA, and it's used in something known as drip and ship.
So drip and ship, TPA therapy, is when the patient is typically seen at a smaller or community hospital. They get evaluated, they get that IV TPA started in an arm vein, and then they get loaded onto a helicopter or an ambulance and shipped to the more comprehensive stroke center where additional treatments can be given if they're needed.
1, 2, 3.
Across the country, the push is on to establish systems for stroke care to ensure the sickest stroke patients are quickly transferred from smaller community hospitals to comprehensive stroke centers.
It doesn't look like he's gotten any better from the TPA.
For patients who do not respond to the first round of TPA, comprehensive centers are equipped to take treatment to the next level.
We're gonna get started.
Here's where advancements in scanning technology come into play. One type of scan uses contrast dye that allows doctors to visualize blood vessels in the brain and identify the area of blockage.
And it's cut off right here at this point.
Such scans provide doctors with a roadmap to make repairs in what's called an interventional neuroradiology lab.
People are very familiar with a heart lab, a heart catheterization lab, but in this case, this is targeted toward the brain.
Just a little bit on the table.
Just like in a heart lab, doctors work with tiny wires threaded through catheters inserted in the leg. To reach a vessel up in the brain, doctors often first must clear plaque from a narrowed neck or carotid artery.
Yes, we're going to put a short little catheter in the leg, and then through that short catheter we put long, flexible, very small catheters through the body and up into the neck.
Similar to devices used in heart procedures, doctors can use stents to push back plaque and create a tunnel. Dr. Ferguson demonstrates how they work.
I slowly retract the plastic sheath, exposing the stent, allowing it to expand, and now the stent is fully expanded and released.
Now we have the carotid artery open. This is the stent within the blocked vessel, which looks like an hourglass.
With a stented pathway, doctors then navigate to vessels higher up, where they can inject targeted doses of TPA or use other tools like the suction device on the end of this tiny wire.
The tiny wire will pass through the catheter and will pass into the clot. The knob at the end of the wire will break up the clot and will allow the clot to be sucked back through the catheter as suction is applied outside the body.
So it's almost like Roto-Rooter.
Yes, it's just like Roto-Rooter. This is the wire within the catheter that's right exactly at the level of the clot. Okay, suction on, please. The suction actually pulls the clot out of the vessel and all the way down through the catheter and then into this container. You can see now that all these vessels are lit up, which means that blood is flowing through them normally again.
Dr. Ferguson shows other before and after images.
Before, you can see there aren't any black squiggly lines. These blood vessels are missing from this area of the brain. And afterwards, after the drug has been injected, you can see those black squiggly lines are back.
Blood flow is restored.
And blood flow is restored, and with it, the function that was lost is now restored also. So 30 years ago, we would simply pull the curtain on the patient and allow nature to take its course. Today, we have many different treatments that can be brought to bear that can not only improve outcome, but sometimes completely reverse the effects of a stroke.
Just like saving heart muscle in heart attack, the key to saving brain cells during a stroke is time. The ideal time frame to start the initial round of TPA for the average person is usually within 3 hours, and within 6 hours for targeted therapy in the interventional lab. But Dr. Ferguson says there's a caveat to that. Everyone's plumbing is different.
He was pretty narrowed right at this junction right here.
Some people have extra pipes feeding blood to their brain, which extends the window of opportunity to save tissue.
So if you're having a stroke and you happen to be one of the lucky people who has excellent alternative plumbing pathways, what we term excellent collaterals, you may have 10 hours or 12 hours, a much longer time than the average person would have to derive benefit from these types of treatments. And so it's essential that you don't miss this opportunity, that you come into hospital immediately.
In Bill Forrester's case, paramedics transported him to a community hospital where an initial round of TPA was given. Forrester was then flown to a comprehensive stroke center.
What time is it?
Well, how you doing? You okay?
Where doctors inserted a series of stents in his left carotid artery.
So they started at the furthest part and put a stent in, and then in overlapping succession put in a total of 5 stents.
So they basically built a tunnel for the blood.
They basically built a tunnel for the blood.
And now you can see that the vessel here is open.
But the procedure was only partially successful. It became too risky to unclog an additional blockage higher up in his brain.
That is where the clot is, right here.
The blood vessel, which was blocked in the upper part of the brain, is what resulted in his final stroke. We did the MRI the next day. The stroke that we see is in the distribution of that blood vessel, and that is in the area of his language and also his strength on the right side.
Forrester spent 7 days at University Hospital's Case Medical Center and was then transferred to Lakewood Hospital, a Cleveland Clinic hospital, for what would become an intense battle for recovery.
The shock, I think, set in after a couple weeks when he was waking up and we were realizing his capacity. He could not speak at all. He He was trying to say something, but it turned into nothing. He would say, and that's as far as it got.
Bill's stroke wiped out the communication centers in his brain.
The most frightening thing is that most patients don't die from a stroke. They live with a disability.
Bill Forrester was now in the fight of his life to rebuild his identity and remodel his brain.
Watch my mouth. E. Good.
This is someone who has major deficits, but at the same time, I also thought to myself, this is someone who is so motivated and seemed so full of energy and willingness to improve himself that despite that, I thought he had a real fighting chance, to beat this. Now let's have you look at my hand here, and then up, over, down, and over. Wonderful.
Bill Forrester had spent most of his adult life as an avid reader and an eloquent speaker.
Communication from my father, that kind of defined his life and his existence.
Anyone who knows Bill Forrester, they know him as a very chatty person.
Growing up on Cleveland's west side, Forrester was an articulate, expressive teen, sporting a 6-string electric guitar, playing in a garage band. After high school, he traveled the world in the Navy and earned a college degree in business. Later, Forrester put his communication skills to work as a negotiator for the Department of Labor, an instructor at Lorain County Community College, a realtor, and the hub of the family.
Here's the guy that answered all the questions, and he was the head of the family, and he's the one with all the answers. And for that to be taken away right away, it was a heavy burden.
18 days after his stroke, Forrester was released from the hospital.
Open your mouth and say, A.
A.
Good.
A few days later, he began what would be almost 2 years of outpatient speech therapy for a condition called aphasia.
Aphasia is, in broad terms, any kind of a problem with your ability to either understand or communicate the content of language.
As Forrester's wife researched the topic, she found few success stories.
It's really hard to find positive, uplifting, hopeful stories that really don't conclude with they've accepted their fate. I read a bunch of stories like that, and I don't want to hear that.
As a wife and a mother, how did you deal with your family's life being turned totally upside down?
Bill got settled in at home again, and we realized what we were facing. It was just about to make his life easy so that he could focus on his recovery. And that meant my role changed, our daughter's role changed, his son's role changed.
I need help for my phrases. Right?
Okay. Our daughter, who was in 7th grade when this happened, she had to start teaching her dad, helping her dad learn how to identify letters.
It's humbling to sit with your dad, teach him his ABCs and how to articulate or manipulate his tongue so he can pronounce A or B, something so trivial and something we take for granted.
Mandatory. Try it again. D-A.
Okay.
We started with vowels, and we worked on up to consonants, and then on to words, phrases, and then eventually sentences. Bill was pretty tireless in practicing and constantly working. He made it his job.
And with time came progress.
Alert you to the possibility.
Good job.
My phrases is coming back, like vowels, words, vocabulary. Now it's phrases coming back. So it's funny, for me.
Ready?
Ready.
Set, go.
Besides talking, Forrester, who is right-handed, had to relearn how to move his right arm, hand, and fingers. For all stroke patients, the key to recovering function, be it movement or speech, is repetition. Repeating exercises helps strengthen muscles. Repetition also allows the brain to build new connections, so healthy parts can take over for the damaged ones.
So what we have to do is take the good parts of the brain that are near the damaged parts in other parts of the brain, any part we can basically, and try to basically convince or encourage those nerves to literally sprout new connections.
Control the stimulation.
One therapy to achieve this involves using low doses of electrical currents on affected limbs. It's called functional electrical stimulation, or FES, and Cleveland has become a world leader in it. One system being studied uses a sensory glove on the patient's good hand to send electrical impulses to the weak hand. When the thought enters the brain to move the good hand, electrodes stimulate the weak one to also move. The goal is to encourage the brain to remodel itself to once again control movement of the compromised hand.
The more repetition you get, the better. And if they practice long enough, the brain may reorganize and form new neural connections that reconnect the brain back to the muscles so that the patient doesn't need the stimulator anymore.
When it came to regaining movement in his dominant hand, Bill Forrester got extra practice thanks to research at the Cleveland Clinic. Forrester became the first person in the country to participate in a research study for the Hand Mentor.
I don't care. I could try anything, you know, because I want to be whole.
Patients use the Hand Mentor at home, while a physical therapist at the hospital keeps tabs on their progress. Dr. Jay Alberts demonstrates how the system uses video game technology to help patients practice motion control.
This is where we talk about the precision of control. You know, it's not about how strong are you, it's about how do you control your forces.
I couldn't do this before.
62% of daily living activities involve the hands, which can be particularly problematic for stroke patients.
Many stroke patients have problems doing functional activities with the hands, primarily because they can't release their force. They can grab something hard, but they can't release it. So that's really the final aspect of skilled performance, is setting something down and releasing.
Pressure's on.
So seeing this, what kind of progress? What do you think of when you see this progress?
Oh, it was just amazing. He could not have picked up anything with his hand before.
Another recent milestone for Forrester came when he picked up the guitar he bought 40 years ago, grasped the pick with his right hand, and began to strum.
It's emotional. I thought I couldn't do it. So when I did it, okay. All right. It's an old friend. And I have to think about how could I play this chord. It's the same thing for my words now. But I could do it now. Everything is coming back, you know?
2 years after his stroke, Bill Forrester spends part of his time encouraging other stroke survivors, telling them his recovery story. He started a support group at Lakewood Hospital called Reset. Forrester remains equally dedicated to raising awareness about all forms of cardiovascular disease.
This is my cause in my life now.
The main risk factors for stroke include the same things that put people at risk for heart attacks. These include smoking, or having diabetes, high cholesterol, or high blood pressure.
Controlling high blood pressure can reduce people's risks by about a third.
Good afternoon, Bill. How are you doing today?
Bill Forrester did not have any of the typical risk factors and had always led a healthy lifestyle.
Strokes can affect anyone at any time. And that's one of the awful things about stroke is that it can occur out of the blue. Even if people are healthy, it's much less common, but it can happen.
About 90% of patients who have large left brain strokes like Forrester's suffer permanent major disability. That's why Forrester's story is so remarkable.
I mean, he has made absolutely amazing progress. This was a man who was barely able to speak a word or two to me before, who now can often speak complete sentences, whose comprehension is intact, who has gone to not really being able to participate in any aspect of his life to really making major gains.
Forrester has had lots of things in his favor. He had access to expert medical care and health insurance that allowed for extended therapy. He's also intelligent and younger than the average stroke patient. When it comes to remodeling, younger brains do better.
I am better. Great.
The most important thing Forrester has on his side is relentless determination and ongoing support from his family.
Thank you for everything. Everything.
To learn more about stroke, visit our website at health.ideastream.org. Watch web-exclusive videos on stroke prevention and follow doctors into the operating room to watch brain surgery from start to finish. Plus, view special content provided by our partner, Net Wellness, a consumer health website offered as a public service from Case Western Reserve University, The Ohio State University, and the University of Cincinnati. Go to health.ideastream.org to watch, listen, and link to stories, programs, and information, and share your story if you or your family has been affected by stroke. Funding for Surviving Stroke comes from the Dr. Donald J. Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, the Sisters of Charity Foundation of Cleveland, the Woodruff Foundation, the Community Foundation of Lorain County, and the United Black Fund of Greater Cleveland, Incorporated.